Hello there, I'm Maria from Older, Fitter, Stronger, and this video is for anyone who struggles with back pain and needs some strategies to be able to deal with it a little bit better. I'd be delighted if you would like and subscribe to my channel. You'll then get notifications of any future videos. Let's get going. So we're going to start off lying down. You can do this on your bed or on the floor. Make sure you've got a little pillow or a towel under your head if your neck's a bit stiff. Just relax the shoulders, and we're just going to start by breathing in and breathing out. I've got my hand on my rib cage because I want to be able to breathe into the rib cage rather than the shoulders and the upper chest. So try and see if you can breathe a little bit less from here and a little bit more from here. And as you breathe out, think about letting the lower back settle and release. If your back is quite stiff, you might find that your back is kind of arching off the floor a little bit. You're holding it quite stiffly without realizing, possibly because you're experiencing pain and that makes you tense the muscles up. So we need to try and let those muscles relax. So again, breathing into the rib cage and the back, and then letting those muscles go. Breathing in and letting go as you breathe out. We're then just going to gently take the knees from side to side. So just go to where you can go. Breathing in and breathing out. And we're just mobilizing the back and the hip a little bit. Do that as many times as you want. We're just going to do it 3 or 4. And then come back to the center. And we're just going to bring the right knee in towards the chest, breathing in, big expansive breath. See if you can breathe into the lower back. And then as you breathe out, let go. And again, breathe it in. See if you can breathe into the lower back and expanding. And as you breathe out, let go. Same on the other leg. Breathe in. Expand, breathe out, let go. Breathe in, expand. And breathe out, let go. Release the leg. Coming into some pelvic tilts. This is just a way of moving the lower back, which is possibly quite stiff. So we're just going to arch the lower back away from the floor. If you can see that, I'm arching away there. And then tipping the lower back towards the floor. I've just got my hand here so it's out of the way and you can see what I'm doing. So arch the back away from the floor, tip the lower back towards the floor. Arch away, tip back. Arch away, tip back. One more, arch away and tip back. And we're going to keep that tip back so you can feel the lower back is in contact with the floor. Keep your feet hip width apart, and we're going to start to roll up through the spine. So imagine each vertebrae lifting up one at a time, pressing through the feet so that your legs help you to come up. When you get as far as you're going to go, breathe in, and then as you breathe out, roll back down. So we're going to be really gentle here. If you're experiencing pain, you're not going to work into pain, you're just going to go really easily and gently, and then come back to the bottom, breathe in, as you breathe out, tip back and roll up again. Breathing in at the top, breathing out as you roll back down. And you're going to do it one more time. Breathe in, arch, breathe out, tip, and roll through the spine. Really gently, breathing in at the top, breathing out as you come back down. If you can, you're going to put your right leg onto your left knee. And you could just stay here and get a little bit of a stretch through the hip. If you're able to, and if it feels easy, you can take the hand behind this bent leg, this left leg, and just hold it there to increase this gentle feeling of stretch. But if that's not comfortable, you just leave the foot on the floor. If that brings on any symptoms, nerve tingling, for example, in the foot or the leg, then just release. Switching sides. Left leg comes onto the right knee. You can hold that there for maybe 10 or 20 seconds. And if you want to, you can lift up the right leg and hold it there to increase the stretch. Just breathing gently, letting the out breath release the muscle. And then release the leg back down. If you want to, you can then do another little swish from side to side with the knees. Coming onto all fours, and again you could do this on your bed, so it's a little bit softer on the knees, or you can do it on the floor as able. We're just going to round the lower back. Round the lower back and release. So breathing in and breathing out. So again, we're trying to mobilize the lumbar spine. Round and release. Round and release. One more. Round and release. And then taking the legs wide, just take the hand over to the left, the right hand on top, and then just sit back to where you can sit back. If you have a cushion or a pillow, you could put it under your bottom so you've got something to rest on if you can't go down as far as I am. And you should now be getting a stretch down the side of the back. And then we're going to switch to the other side. Just breathing in there and breathing out. Coming up slowly, we're going to take your right leg forward, extra padding under this knee if necessary, and a little tuck at the pelvis so you can feel the bottom muscles light up a bit. I've got something here I can hold on to, and I'm just drifting forward and back. Getting a little stretch through the front of the hip, which can contribute to discomfort in the back if the hips are, and the front of the thighs are a little tight. So just having a gentle stretch there, and then you could switch legs and do it on the other side. So a little tuck, and then a drift forward and back. Lovely. And if you can't get down onto your knees, you can come into standing. Take the leg behind you. Just tuck under here at the pelvis. So the bottom is a little bit tight. And then just gently press the hip forwards so you get a little bit of a stretch down the front of the hip there. And then same on the other side. Take the leg back, little tuck, and then hold and breathe. Hold and breathe. And then we're going to stay standing, have our feet hip width apart, soften the knees, stick the bottom out behind you. Feet hip width apart, knees tracking over the middle of the toes, nice flat back. So you just go to where you can go. If you can only go here or here, that's fine. The bottom is pushing back and you're just bending and straightening the knees. So the back is not moving. You see my back is completely still. The only thing that's moving are my knees. Just getting a little gentle stretch at the back where your hamstrings are. And then come up into standing. I'm going to grab a chair to show you another little stretch you can do. So hands on either side of the chair, walking back, still with the feet hip width apart. And I'm just stretching forward. Bottom is traveling back. My knees are softening, not poker straight. And you should get a bit of a stretch through the spine. Breathing in and breathing out. Breathing in and breathing out. And then slowly come back up. So there you have some nice mobility and stretching exercises that should help your stiff lower back. On the next video, we're going to look at some strength exercises that you can do to stop your back pain from coming back.